Hello, my name is Lucy Gillespie. I'm a doctoral candidate from the University of Pittsburgh Graduate School for Public and International Affairs. This project is co-authored by Daniel Jones, Sarah Lenardi, and myself, and looks at willingness to pay for personal protective equipment during the height of the COVID-19 pandemic, before wearing face masks had become heavily politicized. We ask, how does the efficacy of government messaging in response to a risk vary with the salience of that risk? We used an experiment conducted on April 13th across 12 states in the U.S. through survey hosting site Prolific to recruit 512 participants. The experiment began with a baseline survey, which all participants completed. Then we randomly assigned them into one of two salience treatment groups. Our state stats group was shown a message that provided information about how many cases, deaths, and tests had been performed in their state as of the day of the survey. This message was meant to bring COVID-19 awareness to the front of participants' minds, and in fact, those who were shown this message viewed the pandemic more seriously. Our no state stat, or low salience group, was shown nothing. After assignment into those groups, we further randomly assigned participants into one of 5 messaging groups: control, pro-mask, anti-mask, positive, and negative forecasts. The anti-mask message discouraged face mask usage, while the pro-mask encouraged it. Both were actual recommendations from the CDC that had occurred within a 2-week window of the survey. These messages were intended to see if action-oriented messages impacted decision-making. The forecast messages provided participants with either a positively or negatively framed projection from the federal government about the number of cases expected by the end of August. These messages were included to understand how communication about risk influenced behavior. After random assignment, participants were asked to complete a choice task in which they would have an opportunity to win one of 2 items after the survey. They were given 100 lottery tickets and were asked to allot them between 2 choices: an N95 face mask, which was unavailable for purchase at the time, and a $75 gift card to Starbucks. So, for example, if they strongly preferred the gift card, they could put 100 tickets into that option and 0 in the face mask option. Or they could allot tickets in any distribution between the two. 96% of participants completed this correctly, so we had 493 participants in our full sample after completing the choice task. After the choice task, all participants completed an exit survey that consisted of questions about behavior and perceptions about the pandemic. So what we see when we look at the share of participants with mask demand, those who bid 1 or more tickets on the mask, is that among the full sample shown in panel A, there is a significant difference between the anti and pro-mask groups, with the pro-mask group bidding more tickets on the mask than their counterparts. But if we consider what drives this difference between the anti and pro-mask messages, we can look to panels B and C, where we split the sample between those who did not receive information about their state in panel B and those who did in panel C. The effects seen in panel B indicate that the difference seen in the full sample is driven by those in the low salience treatment group, or those who were not shown info about their state. Notably, all panels show no significant difference among the forecast groups. To investigate further, we constructed the following model that considers the effects of messaging split by salience on our outcome variable, which here is the binary, if the participant bid more than 0 tickets on the mask. And we see that the results from the previous slides are robust when controlling for age, gender, partisanship, self-reported health score, and an indicator for urban dwellers, as well as considering state fixed effects. On the left, in the red highlighted portion of the table, we see the full sample and sample split by our state stats treatment, showing that indeed when controls and fixed effects are included, there is a significant impact on mask bids driven by low salience group. Other research, however, has shown that certain demographics, namely conservatives, are less responsive to social distancing recommendations. So when considering Republicans and Libertarians as non-movable, when we exclude them from the sample, we see the strengthened effects in the blue highlighted portion, with liberals being more responsive to both pro and anti-mask messaging. What we can take away from this is 2 main points. First, that action-oriented government messages have an impact on both perceptions about risk and on behavior. And second, that the impact of messaging on behavior is strongest when risk is least salient. Though this study was conducted in the context of COVID-19, it can be applied to other policy arenas, such as vaccination campaigns, hurricane and wildfire evacuations, alcohol and tobacco warning labels, and product safety, such as auto recall notices. Thank you so much.